Hello. So today I will be teaching an older adult how to properly self-administer eardrops safely and effectively. So let's get started. Hello, my name is Caitlin, and I'm going to be the nurse helping you with your eardrops today. So today we're going to learn how to put your eardrops in safely. So this is important because proper use helps medication work well and prevents ear infection or discomfort. And by learning this skill, you can take care of your own ears at home safely and confidently. Okay? Does that sound great? Good. All right. So eardrops are medicine that help with ear infections, earwax buildup, or inflammation. So when we put the eardrops in the ear, the medicine goes right to the spot that needs it, helping your ear heal faster and feel better. Okay. So we're going to do a step-by-step process. So step one is always going to be wash your hands thoroughly with soap and water. So you have an ear infection right now. So we want to make sure that we're not getting any other gunk or any other germs in that ear infection. Okay. We're trying to prevent that. So we're going to wash our hands thoroughly. And then the next step is we're always going to check our medication. Okay. We want to make sure that we have the right medication, that it's going in the right ear, and that it has not expired yet. Okay. Because expired medication is not going to work as effectively with you. Okay. So then this bottle says that we need to shake it well before we use it. Okay. So we're going to shake it gently for just a little bit. Okay, now we're good there. So now to position yourself, you have two different positions you could choose from. Okay, so you could choose to sit down and you can lift or you can tilt your head over as far as you can to make sure that the ear is standing straight up. And then if that's not very comfortable for you, then you can always lay down. And then since it is your right ear, we're going to lay on our left side, making sure that right ear is facing up and out. Okay. So with that, the next step, I'm going to teach you from the sitting down position. Okay. So we're going to tilt our head all the way over like this, making sure that ear is up and out. Okay. Then we're going to take it from the back part of our ear. We're going to pull back and up. Okay. Making sure that that ear canal is nice and open right there. Do you see that? Perfect. So then now we're going to drop the eardrops into your ear. So this one says you need to drop it 3 times. So we're going to do 1, 2, 3. It's very important to make sure that you are not touching the dropper to your ear. Okay. Because remember, we're trying to prevent that ear infection. We're trying to get rid of it. So we don't want that ear infection to get on anything that needs to be clean. Okay. And if you're continuously putting these eardrops in there, the tip of it needs to be clean. Okay. So then we're going to do our 3 eardrops, 1, 2, 3. And then we're going to leave our head in this position for a little bit. Okay. We got to make sure that those eardrops are getting nice and deep down in there into the affected area. Okay. That is how they will work the best for you. So once we're done with that, okay, we need to remember that we're not going to touch the inside of the ear. Okay. Remember, we're trying to get this infection out of here. So we want to make sure that everything is staying as clean as we possibly can keep it. Okay. All right, so with that, remember if you do have any excess liquid or maybe you missed one of the drops a little bit, it's dripping kind of down the side of your cheek, you can always take a cotton swab and just kind of set it on there and get that extra or excess liquid off, okay? But it is very important to make sure that we are not pushing that cotton ball any deeper into the ear. We can set it right on top to get that liquid, but we don't want to irritate the ear anymore. We don't want to get that cotton ball stuck in there. So we want to make sure that we're just resting it on top, okay? And then after all that is said and done, we are going to wash our hands again. So remember, we're dealing with an ear infection. So we got some germs and gunk in there. We want to make sure that we're not getting that into the other ear, into our eyes, into our mouth or nose. Nothing like that. We're going to wash our hands thoroughly again with soap and water, just making sure that everything is clean. Okay. Then and that's going to be all the steps, okay? So now let's practice together. I'm going to demonstrate first, and then you can try it using the same steps, okay? Remember, gentle movements are important, and we don't want to hurt that ear anymore, okay? So take your time and follow the steps slowly, and that's totally fine, okay? All right. So now it's your turn. So I'm going to watch you do it, and I'm just going to ask you a few questions while we're doing this just to make sure that you understand why we're doing what we're doing, okay? So first question is, why is it important for you to wash your hands before and after? You're right. We don't want to spread that infection anywhere else, and we don't want to add any other germs into that infected ear. Nice job. And then which way do we pull the ear? How are you going to pull that ear to make sure you're getting those drops in there most effectively? That is right. You're going to go up and back just like that. Good job. All right. And then remember, using your eardrops exactly as we practice will help your ear feel better and prevent complication. If you ever have pain, swelling, or any questions, call your healthcare provider. And then you're doing a great job learning this new skill. You got it. You're going to do great. Okay. And we'll get this ear infection taken care of as soon as possible for you. Thanks.